Your kidneys may be under more strain right now than you have ever realized. And here is the terrifying part. They will not tell you. No warning, no pain. Not a single signal until the damage has already been building for years. And by the time most people find out, they are already sitting in a doctor's office staring at a number on a lab report that has just quietly divided their life into before and after. But a few years ago, something unusual started showing up in medical research. A simple ingredient, 1 teaspoon, dissolved in a glass of warm water every morning, was producing measurable changes in kidney filtration rates and blood pressure readings in just a matter of weeks. Not in one study, in multiple independent studies across different countries, replicated by different research teams, arriving at the same conclusion. And the medical world had a complicated relationship with that conclusion, because the ingredient was not a drug. It was not a patent. It was something that has been sitting in your kitchen cabinet this whole time. Stay with me, because what I am about to walk you through is not a wellness trend. It is a convergence of ancient observation, modern molecular biology, and a truth about your body that most people will never hear in a routine checkup. If this kind of science is what you come here for, subscribe to Dr. Victoria Reed right now. Every week, we bring you the studies your doctor did not have time to read. I want to tell you about a man named Gerald. Gerald is 63 years old. He lives in Columbus, Ohio. He worked as a high school football coach for 31 years. He ate what most Americans eat: fast food a few times a week, plenty of processed snacks, not enough water. He felt fine. He had energy. He had no idea anything was wrong. Then, in 2019, during a routine physical, his doctor ran a basic metabolic panel. His creatinine levels were elevated. His eGFR, that is, his estimated glomerular filtration rate, the standard measurement of how efficiently the kidneys are cleaning the blood, had dropped to 54. Normal is above 90. Gerald had been living with stage 3 chronic kidney disease for what his nephrologist estimated was at least 5 years. No symptoms, no warning. Half a decade of invisible damage. His blood pressure had been sitting at 148/92 for years. He thought it was just stress from coaching. Gerald is not unusual. He is, statistically, the average. In the United States right now, 37 million adults have chronic kidney disease. That is 1 in 7 Americans. And according to the National Kidney Foundation, up to 90% of people with early-stage kidney disease have no idea they have it. The kidneys are so efficient at compensation, so quietly heroic in their adaptability, that they can lose nearly half their functional capacity before a person notices a single thing. This is not a scare tactic. This is biology. And it is the reason what I am about to tell you matters more than most health information you have encountered this year. To understand the solution, you first have to understand the enemy. And the enemy has a name. It is called chronic low-grade inflammation. Not the kind of inflammation you feel after a sprained ankle. Not the acute, visible kind that arrives fast and leaves fast. This is the slow kind, the invisible kind. A persistent systemic fire that burns through your tissues over years and decades without ever announcing itself. Here is what it does to your kidneys specifically. Inside each kidney, you have approximately 1 million tiny filtration units called nephrons. Each nephron contains a small ball of capillaries called a glomerulus, surrounded by delicate membrane tissue that acts like a microscopic sieve, separating waste from nutrients, toxins from proteins, everything that needs to leave the body from everything that needs to stay. When chronic inflammation is present, and in most adults over 40 it is, it slowly damages those membranes. It stiffens the surrounding blood vessel walls. It triggers a hormonal cascade that constricts vessels, raises blood pressure, and forces the kidneys to work harder under worse conditions. Over time, nephrons scar. Scar tissue cannot filter. And once a nephron is lost, it does not come back. This is the actual mechanism of kidney decline. Not a sudden event, a slow erosion driven by inflammation, accelerated by the way most modern Americans live. And here is where the story takes a turn that researchers honestly did not see coming. In 2006, a research team at a major medical institute in New Delhi began investigating the effects of curcumin, the primary bioactive compound in turmeric, on kidney inflammation markers in patients with early-stage chronic kidney disease. This was a randomized, double-blind, placebo-controlled trial. The the gold standard of medical research. 62 patients. The curcumin group received a standardized extract daily for 8 weeks. What they found surprised them. Patients receiving curcumin showed a statistically significant reduction in urinary monocyte chemoattractant protein 1, a key inflammation marker directly associated with kidney damage progression. Oxidative stress markers dropped measurably, and systolic blood pressure showed consistent improvement compared to the placebo group. The mechanism that explained these results took another few years to fully understand. Curcumin, at the molecular level, inhibits a regulatory protein called NF-κB. This protein acts as the master switch for inflammatory response in human cells. When NF-κB is chronically activated, as it is in most people living on a modern Western diet, it keeps the body's immune system in a state of permanent, low-level alarm. Vessels stay constricted. Kidney membranes stay under pressure. Blood pressure stays elevated. Curcumin interrupts that signal. Not harshly, not in the way a pharmaceutical drug overrides the system. It works with the body's own regulatory pathways to quiet the alarm. The vessels begin to relax. Filtration improves. Blood pressure trends downward. A 2017 meta-analysis published in the journal Nutrition Research reviewed 8 randomized controlled trials on curcumin and blood pressure. The pooled data showed a statistically significant reduction in both systolic and diastolic readings. The average reduction in systolic pressure was approximately 4.1 millimeters of mercury. That may sound small, but population studies consistently show that a sustained 5 millimeter reduction in systolic pressure cuts stroke risk by 14% and heart disease mortality by 9%. These are not trivial numbers, but here is where the story gets complicated, and this is the part most health videos skip entirely. Turmeric is not the whole picture. I need to be direct about this because too many health channels will tell you one food is the answer, and then the comments fill up with people who tried it for 2 weeks and saw nothing change, and they are right to be skeptical. No single ingredient reverses years of accumulated damage on its own. The research does not support that claim, and I will not make it. What the research actually shows is that curcumin works as a meaningful component of a broader intervention, and if you treat it as a magic solution while ignoring everything else, you will be disappointed. The 4 factors with the strongest clinical evidence for kidney health and blood pressure control are these. First, hydration. Your kidneys physically cannot filter waste without adequate water. The filtration process is water-dependent at every stage. Studies from Johns Hopkins have shown that even mild dehydration, losing just 1 to 2% of body water, significantly reduces kidney filtration efficiency and triggers the same hormonal cascade that raises blood pressure. Most Americans are chronically mildly dehydrated and have simply adapted to feeling that way. Second, sodium reduction. The kidneys regulate blood pressure primarily through sodium and fluid balance. The average American consumes nearly 3,400 milligrams of sodium per day. The recommended limit is 2,300. Many nephrologists believe the target for optimal kidney function should be closer to 1,500. Excess sodium directly activates the renin-angiotensin system, the hormonal loop that constricts blood vessels and forces pressure upward. No amount of curcumin compensates for a diet saturated in sodium. Third, blood glucose control. Diabetes and prediabetes are the leading causes of kidney disease in the United States, responsible for 44% of all new cases, according to the CDC. Chronically elevated blood sugar damages the capillaries feeding the nephrons, causing exactly the scarring we described earlier. Managing glucose is not optional for kidney health, it is foundational. And fourth, this is where curcumin earns its place in the conversation: targeted inflammation reduction. When the first 3 factors are being addressed, curcumin provides a scientifically supported additional layer of protection. It targets the inflammatory mechanisms that damage kidney tissue even when diet and hydration are reasonably managed. It improves vascular elasticity. It protects nephron membranes against oxidative stress. Think of it this way: hydration, sodium reduction, and glucose control are the structural repairs. Curcumin is the protective layer applied on top of those repairs. Both matter. Neither alone is sufficient. Gerald understood this eventually. After his diagnosis, his nephrologist placed him on a low-sodium diet and pushed him to drink at least 2 liters of water daily. He also discovered he was pre-diabetic when his glucose was finally tested properly. 6 months into those changes, his eGFR had stabilized at 56, no longer declining. Then he added the turmeric protocol consistently. 12 months after his diagnosis, his eGFR was 61. His blood pressure was consistently below 130/80 without medication. His nephrologist called it an unusually positive trajectory. Was it the turmeric alone? No. Gerald would be the first to tell you that. But did the curcumin contribute within a broader intervention? His numbers suggest it did. Now here is why most people never actually benefit from turmeric, even when they try it. There is a fundamental chemistry problem that the supplement industry rarely explains clearly. When you swallow curcumin in its raw form, your digestive system metabolizes and excretes the majority of it before it ever reaches your bloodstream. Multiple pharmacokinetic studies have confirmed that raw curcumin has a bioavailability of less than 3% in humans. Less than 3%. You could consume turmeric every day for a month, and most of it would pass through your system without ever reaching the tissues where it needs to work. For years, this was the wall separating the promising lab results from real-world outcomes in humans. And then researchers discovered something that had been sitting in every kitchen right next to the turmeric the entire time. Piperine, the active alkaloid in black pepper. A landmark study published in the journal Planta Medica found that combining curcumin with just 20 milligrams of piperine increased curcumin's bioavailability by 2,000%. Not 20, not 200, 2,000. The mechanism is precise. Piperine inhibits specific intestinal and liver enzymes that would otherwise rapidly break down curcumin before absorption can occur. It essentially slows the metabolism of curcumin long enough for the body to actually use it. A small pinch of black pepper, the amount you can hold between 2 fingers, contains enough piperine to transform the bioavailability equation entirely. This is the scientific basis for the turmeric water protocol. Not just the turmeric, the combination. Here is the exact preparation, and the details matter. Take 8 to 12 ounces of warm water, not boiling, but warm, around the temperature of a comfortable tea. Boiling water can degrade certain volatile compounds in turmeric. Add 1 level teaspoon of high-quality turmeric powder. Quality is not a minor variable. Independent laboratory testing has found that cheap turmeric is frequently adulterated or contains far lower curcumin concentrations than the label states. Look for organic turmeric from a verified source, ideally one that specifies curcumin content of at least 3% by weight. Add a small pinch of black pepper and stir thoroughly. If you want to further enhance absorption, a few drops of a healthy fat, cold-pressed coconut oil, or a small splash of full-fat milk improves uptake additionally because curcumin is fat-soluble as well as piperine enhanced. Drink this in the morning, consistently, every single morning. The research on curcumin does not show dramatic overnight change. What it shows is a gradual, measurable improvement that builds over 4 to 8 weeks of daily consistent use. This matches the timeline of the damage it is addressing. Slow accumulation, slow repair. This is not a quick fix. It is a sustained, evidence-based intervention. What you may notice over those weeks, if your kidneys are under strain: slightly improved morning energy, reduction in mild ankle swelling you may have stopped noticing, blood pressure readings that trend gradually downward when you measure them consistently. Not dramatic, real. But the part of this story I want to leave you with has almost nothing to do with turmeric. It has to do with Gerald sitting in that exam room in 2019, looking at a number that told him 5 years had already quietly passed. 5 years of his kidneys sending signals he had no framework to receive. 5 years of inflammation building, nephrons slowly scarring, blood pressure climbing toward a threshold nobody warned him was approaching. He is not a cautionary tale. He is the median. He is statistically the most common story in American kidney disease, which means the person watching this right now, you, may be somewhere on that same quiet timeline. In the early chapters, before the diagnosis, before the number, before the conversation that changes everything. And the question that matters is not what you do after that conversation. It is what you do right now, before it. The research on curcumin, on hydration, on sodium, on the renin-angiotensin system, on NFKB inhibition, all of it is pointing at the same basic truth. The human body has powerful, built-in repair and regulation systems. It does not need to be overwhelmed with pharmaceuticals at the first sign of strain, but it does need to be supported. It needs water. It needs lower sodium. It needs reduced inflammation. It needs the tools to do the work it was designed to do. 1 teaspoon of turmeric in warm water with a pinch of black pepper is not magic. It is one small, science-backed piece of a system of daily support. Simple enough that there is no reason not to start it today, and consistent enough over weeks and months to contribute to measurable change when combined with the foundational habits that matter. Your kidneys have been working without acknowledgement for your entire life. Through every bad meal, every year of inadequate hydration, every decade of accumulated stress, they compensated quietly. They adapted without complaint. This is not the video that tells you 1 spoon of turmeric will fix everything. This is the video that tells you your kidneys deserve your attention before they need your emergency. And the science, when you look at it honestly, gives you real, actionable reasons to start that attention today. If you have a blood pressure monitor at home, check it this week and write the number down. If you do not, they cost under $30 and are one of the most valuable investments in your own health you can make. Track your reading for 30 days while you add the turmeric protocol, work on your water intake, and reduce your sodium. See what your own data shows you. Then come back to the comments and tell me what changed. Because the most useful information in this community does not come from studies. It comes from real people, paying real attention, sharing what they actually experienced. If this video gave you something you did not have before, share it. Not for the views. Because the people who most need this information are usually the ones not searching for it. They feel fine. They have no reason to look. Maybe you can give them one. Subscribe to Dr. Victoria Reed if you want to keep going deeper into the science your doctor may not have had time to read. Explained clearly, completely, and without shortcuts. Your kidneys have been silent for a long time. Maybe it is time to start paying attention before the silence breaks.